always good to see Dr. Karen Cassidy back with us again.
It's good to see you.
We're going to be talking about the Children's Foundation today, UnitedHealthcare's Children's Foundation. And this sounds like it's serving a very specific population, a real niche, if you will. Share this with us.
Yeah, it is. So this is a 501c charitable foundation that United sponsors, and it is designed to provide for the needs of children when they have families who have insurance but may still have some financial constraints or issues, and a child with a chronic illness may have costs or expenses or needs that go beyond what insurance covers. And so these are small grants, they're $10,000 or less, to help families in that insured working really working poor population that may have kids who have needs beyond what insurance covers.
How do these families find UnitedHealthcare? How are you linked together with these people who really need it?
Yeah, so sometimes physicians actually are aware of the program and will reach out on behalf of their patient.
Okay.
But there's a website, and we do advertising through the community so that families can individually reach out and apply for a grant as well. And the website kind of walks them through that paperwork and the requirements.
I was going to say, how involved is that? Is it really tough to?
It is not that tough. And I think one of the important things to realize is you don't have to have UnitedHealthcare insurance to apply.
Okay.
So any child who has insurance, who has a need that's not being met, whose family's struggling to pay for that, if it's a commercial insurance product, they can apply.
Commercial insurance, in other words, okay, I'm
So
glad you brought that up. Not TennCare.
Correct. So, I think those social safety nets or the Medicaid programs across the country usually do a pretty job of not letting families have those kind of out-of-pocket expenses. Once you don't qualify for Medicaid and you do have a commercial insurance, but you may still have some financial struggles, covering out-of-pocket or deductibles, or, for example, if your child might need physical therapy or speech therapy beyond what the benefit pays for, those are expenses that can be really difficult for a lot of families.
Or even a device, some type of device,
sure,
maybe.
Absolutely.
So
Durable medical equipment, things like that sometimes are part of what families will request coverage for.
Now, the foundation has quite a track record since it started.
It's our 10-year anniversary. Yeah, it started in 2007.
All right, and you have you've awarded more than 12,000 grants?
Yeah, more than $34 million to kids all across the country. So
that is terrific.
Yeah.
That is really something. Okay, so families can apply for the grants for children covered by any commercial health insurance plan. What are some of the criteria then for the ages of the children?
Yeah, so they need to be under 16, need to be living here in the United States, need to be fully insured, and then the costs have to be related to some type of medical condition. So paying for whether it's, again, things like physical therapy, speech therapy, durable medical equipment, a prosthetic, those types of things. So something related to medical treatment.
And it says there are income criteria and also certain documents.
Yeah, there are income criteria. So this is clearly designed for families who are struggling to pay for things. So there is some income criteria associated with that. And then the website is UnitedHealthcare Children's Foundation, so UHCCF.org. You can get on there and they will it walks you through the paperwork. It's not that difficult to apply.
You were saying before we started, this is kind of a bridge.
Yeah, there is such a struggle for some families, particularly now that we've got these large deductible health plans. This is not, 50, people will say, oh, it's only a $10,000 grant. This is specifically designed to get families over that hump and get the kids what they need. Some people have bigger needs than that, but typically there's a social safety net that will kick in for that. So really it is designed to get over that, like you said, over the hump for these working families with kids who have special needs.
Let's go over what size grant we're talking about. Again, you mentioned something about
$10,000 or less. So $10,000 is the lifetime limit for a child.
All right.
So, and that doesn't have to necessarily all happen in 1 year. So you may have a child, let's say, so there was a young man actually here in our area in Wilson County who had cleft palate repair at 7, had kind of a revision and repair and needed speech therapy. And that child's speech therapy needs exceeded what the benefit was for his commercial insurance. And so they applied to have that covered. And that may, let's say that's $2,000 that year, and then the next year he needs some more. The lifetime limit's $10,000. Each year may even be less than that, depending on what they're requesting for.
Could you have help for multiple children, or just would it just be for one child, or is it just the 10,000 is the limit per family?
No, per child.
Per
so
child,
each grant
okay.
would have a $10,000 limit. So if a family had 2 children with specific needs, it is possible they would have 2 grants, one for each child.
I also saw a note here when you're referring to the child in Tennessee, the 7-year-old.
Yeah.
And you said that from Wilson County that he wants to be a doctor now
Yeah,
when
that's
he
what I
grows
heard.
up.
Isn't that neat? So, you know, I love this program because I feel like it just touches a lot of people's lives, and people who really, they're trying to get done what they need to get done for their kids. And so I think it's a special program. And boy, anybody out there in the community who knows someone who they think would benefit, refer them to that website, reach out, or talk to your physician about
Primary
it.
care
Yeah,
physician
a lot of
about
times
it.
pediatricians or primary care physicians can help with doing that application as well.
Yeah, well, happy 10-year anniversary
I know,
to
it's
this
exciting.
to this organization or to this foundation. And again, we want to give you that website. I bet we've had that up on the screen. UHCCF. There it is. .org.
Yep.
UHCCF.org, and ask your physician about it.
Yeah, absolutely.
All right, Dr. Cassidy, good to see you.
Thanks
Thank you
for
so
having me.
much.
It's
And thanks
good
for
to see
sharing.
you.
It's a great story where you see the impact that it's having on families
Agree,
in Tennessee.
agree. Good
All
to
right,
see you.
Good to see you too. And we'll be back with more after this.